Hello and welcome to the ACE-IT podcast, where we turn science into sense. This is the lucky 13th season of ACE-IT, and we could not be more proud to deliver the rich scientific content to you in a usable and understandable way. ACE-IT is brought to you via the Justice Community Overdose Innovation Network, or JCOIN. If you're new to ACE-IT, welcome, and check out the prior seasons to begin or continue your learning journey. We are exceptionally grateful for every listener, and we promise we will continue working to help you learn and never let you down. Also, a quick plug for a few other JCOIN features. Did you know that you can get technical assistance for your organization from the experts at JCOIN? And did you know you can apply for small research grants to help fund an innovative study idea? Yep, also through JCOIN. And did you know you can apply to be a JCOIN Leap Scholar or investigator to improve your own skills? Also through JCOIN. If any or all of these exciting offerings sound interesting to you, check out our website, www.jcoinctc.org, and learn about the many JCOIN offerings beyond ACE-IT that may help you learn and grow in ways that improve lives, including your own. With that, I'm honored that you're with us. I'm Danielle Rudes, your host, and this is ACE-IT. Welcome to season 13 of the ACE-IT podcast. This season is titled Evolving Responses to Opioid Use Disorder and Overdose, and we are at the midpoint, episode 5, Peer Support and Recovery Groups. In this season, we're examining the shift in prevention, treatment, and recovery strategies in response to the ongoing opioid and overdose crisis in the United States and beyond. From emerging clinical approaches to peer-led efforts, we're highlighting the many ways individuals and systems are adapting to save lives and support recovery. Today, we're jumping right into the role of peer support and recovery groups in helping individuals who are currently experiencing or have previously experienced opioid use disorder. For years, these groups have acted as a method of harm reduction, with peers, specifically those with shared experiences, providing an indescribable value to overdose prevention. While peer support and recovery support groups can take on many forms, some of the more common known 12-step model programs include Narcotics Anonymous, NA, and Alcoholics Anonymous, AA. Rooted in the principle of mutual aid, 12-step recovery groups can foster a sense of belonging, increase treatment engagement, and support individuals as they improve their quality of life. In a 2016 study conducted by Lucia and colleagues, they examined the psychological well-being of 128 members of Narcotics Anonymous. The study found that various aspects of being involved with a 12-step program, particularly keeping connected and comfortable with one's own quote-unquote home group, was strongly associated with better psychological outcomes in members. According to the study, individuals who reported stronger engagement with their home group tended to score high across 4 dimensions: self-acceptance, personal growth, purpose in life, and positive relationships with others. Thus, consistent involvement in supportive groups may contribute not only to abstinence in opioids, but also an overall better emotional and psychological well-being. In a 2021 systematic review conducted by Mercer and colleagues, the authors highlighted the critical role that peer support workers play in enhancing the reach, relevance, and impact of harm reduction efforts. Drawing on research published between 2000 and 2020, the findings of the review suggested that peer-led interventions have been effective in reaching individuals who often remain disconnected from traditional healthcare systems. Those who have experienced an overdose may be subject to these programs under the care of a hospital or a shelter. Previous research on these programs suggests that emergency department-based peer recovery support service can be effective. For example, in a recent study conducted by Traitler and colleagues, 2024, analyzed data from Medicaid of New Jersey, looking directly at those who were treated for non-fatal overdoses between 2014 and 2020. The authors found that when emergency departments added peer support programs where people with lived experience help others, there was a big jump in the number of patients who began treatment using medication-assisted treatment for opioid use disorder. Specifically, about 45% more people started treatment compared to before the program was developed. Such programs act as linkage to care, connecting individuals to support services, which fills a crucial gap in OUD and overdose response. While those peer-led interventions can successfully connect people to treatment, their impact can be undermined by the stigma individuals often face while involved in recovery groups. In episode 1 of this season, we talked about stigma by friends, family, and peers as it relates to MOUD treatment within 12-step groups. In particular, stigma against those using MOD manifests in similar ways, often reinforcing an abstinence-only philosophy that excludes prescribed medications. For example, in a study conducted by Andraka Christo and colleagues, 2022, the researchers wanted to understand how stigma against people using MOUD shows up in 12-step groups and how individuals respond to this stigma. They talked to people who had experience with MOUD and 12-step groups and found that stigma can take on several forms, such as prohibiting individuals on MOUD from serving as sponsors, or in some cases, refusing to recognize their recovery by denying them of their quote-unquote clean time milestones. This makes it all that much more important that we have peer supporters who can provide non-judgmental encouragement for all the steps they take to help prevent relapses or overdoses and ensure individuals feel supported in continuing treatment. While peer supporters often serve as a lifeline for others, the role itself can be incredibly tough. In a recent study done by Crisanti and colleagues, 2022, they highlight the range of challenges peer support workers may face. Hospitals struggle to recruit and fairly pay peer workers due to their tight funding. The fast-paced nature of emergency environments can also make it hard to know when or how to bring a peer support worker in. Individually, peer supporters also need strong supervision and ongoing training to fulfill their roles, a role that can often be emotionally draining. Similar challenges were reported in a study by Memdani and colleagues who identified 5 key themes among peer workers. 1, financial insecurity. 2, lack of recognition in the workplace. 3, housing instability. 4, limited inability to access and or refer individuals to resources. And 5, the constant emotional toll of exposure to death and trauma. That Memdani study, by the way, is a 2021 publication. So, as we've discussed, peer support and recovery groups play a critical role in connecting people to treatment, reducing overdose risk, and offering hope through shared experience. These programs step in during some of the hardest moments in a person's life, whether that's through the emergency department after an overdose or in a community setting where someone is struggling to stay engaged with treatment or fulfilling their 12-step programs. The presence of a peer worker could make all the difference between someone walking away from care or someone taking the next step toward recovery. But for these programs to truly thrive, we have to recognize the importance of their roles. Too often, they face those challenges of unlimited resources or lack of recognition. By investing in the well-being of peer supporters, we are not only valuing their contributions, but strengthening the recovery system as a whole. Thank you for listening to the ACE-IT podcast. We love hearing from you. So if you have comments, topics to suggest, or some science you'd like us to cover in a future season, please write me. Danielle Roods at Sam Houston State University in Texas. My email is droods@shsu.edu. And of course, thank you to the Justice Community Overdose Innovation Network, or JCOIN's Coordination and Translation Center, funded by the National Institute on Drug Abuse, housed at George Mason University, where this podcast originated. Thank you to our fabulous and amazing scriptwriters, and also my fabulous and amazing doctoral students, Bryce Kushmarek-McCune, Jalen Magana, and Caitlin Bauer. And a huge and heartfelt thank you to the team at Slonky LLC for their wonderful production as always. Tune in again soon for another episode and even a whole nother season of ACE-IT.